Well, hello there, and welcome to this week's Be Informed webinar. I'm Michael Brandis, and I'll be your host today with Bingham Healthcare. As you may or may not know, the reason that we started these Be Informed live Facebook webinars is because we wanted to still make sure that we were maintaining social distancing, and we just wanted to make sure that we were continuing to put out information to the public about different medical topics. Today, I'm excited to inform you that we are joined by Dr. Stuart Elvis Rendon. He's a bariatric surgeon and general surgeon. Welcome, Dr. Rendon.
Thank you, Michael.
Thank you so much for taking time out of your schedule to be with us. He's actually going to be answering a number of different questions that have already come in through Facebook about Bingham Healthcare's weight loss program, Empower, and he's going to talk about his specialties, and he's also going to talk about he's also going to answer questions that have already come in. Because this is a Facebook Live, you're more than welcome to submit questions. If we have time, we have a number of questions. If we have time, we'll be sure to answer. I'll be sure to ask those questions to Dr. Rendon, and he can answer them for you. And if we don't have time to answer those today, if we're a little bit limited on time, what we'll actually do is answer those questions on Facebook for you. So we'll make sure that everyone's questions are answered. We'll give those to Dr. Rendon to respond to. So so please submit your questions down in the comments below. And again, don't worry if we don't get to all of the questions. We will eventually respond to those on our Facebook page, and that's Bingham Memorial's Facebook page and Bingham Healthcare's Facebook page as well. And then after, these videos will also be on our YouTube page. So please feel free to forward these to your friends and family if you think that they would benefit from the information today. This is being recorded, so you can forward those or share them on Facebook, and you can like them on our YouTube channel at Bingham Memorial. So the reason we're here today is to be able to talk about our bariatric program, and we haven't had a Be Informed webinar on it, and a lot of people have actually requested it. So we're pleased that Dr. Rendon has taken time out of his schedule to be able to address this very important medical topic. So Dr. Rendon, I know you just started with Bingham Healthcare a couple of months ago. How is everything going? How are you settling into the area right now?
So again, thanks for having me here. Settling great. Idaho was a place that was talked about to me quite a while back when I was deployed with the Air Force. I met a gentleman from Idaho, and he said, you know what, if you're ever looking to come somewhere, come up here, but just don't tell everybody. So it actually worked out nicely that I'm here. The people are wonderful. The towns are great. Southeast Idaho is very accommodating, and my family loves it.
That's great. So would you mind telling us a little bit about where you were born and raised, and then maybe transition into what is it that actually inspired you to go to medical school and then actually pursue bariatric surgery?
So I was actually born and raised in Los Angeles, down in Southern California. My family's from Ecuador. I actually studied both in Ecuador and in Los Angeles, but most of my formative years were in Los Angeles area. I went to UCLA for medical school, and I went off to do my surgical residency. And at the time, I thought I was going to do cardiac surgery. But I actually remember talking to a patient as an intern who had, at that time, what was just considered weight loss surgery. And when I was asking her, well, what exactly is that? And why did you do it? She said, well, I was kind of heavy, and I wanted to lose weight because I really wanted to get up and just play with my kids and my grandkids. So I was like, that's actually really interesting. And the more I looked into it, the more I realized that's something I wanted to do, because it definitely helps change people's lives for the better.
That's excellent, Dr. Rendon. Thank you for sharing that. Would you maybe, for those who aren't as familiar with bariatric surgery, could you just maybe go through maybe 5 or 6 of the things that you specialize in when it comes to bariatric surgery and weight loss?
So weight loss surgery is more than just surgery. It's a whole we call it program, if you think about it. Weight is a problem not just in the United States but worldwide. Even looking at the numbers here in Idaho, it's actually almost tripled since 1990 till now. So what I specialize in is not so much just the weight loss surgery itself, but kind of changing the whole the person, helping them understand what they're going through, having them educated, and then the actual surgery. Now, there's different types of surgeries. There's all kinds of surgeries that actually you can do, but they should be done for specific reasons for specific people. So, and then we talk about that when people come in to talk to me. It's like, well, what surgery should I have and why? Well, we look at it as kind of a tailored approach to what you need. But beyond that is the long-term follow-up that you're going to need to have a successful outcome. Because surgery is a tool, and I tell everybody that all the time. It's a tool, but it's a small part of the whole process of weight loss surgery. But again, that's a tailored experience, at least in my opinion, and how I try to treat patients, because it's more about the health issues, not just about weight. People think, I just want to lose weight. But I look at it, well, let's look at the metabolic issues you may have. You may have high blood pressure or sleep apnea or different things. And that's how I prefer to look at so-called weight loss surgery for patients.
It's an all-encompassing. There's the non-surgical and the surgical. It's an all-encompassing program, and that is customized and tailored to each patient's needs. It sounds like
absolutely. It's not for everybody. Some people maybe for medical issues, or maybe they just don't want to. Do you have the surgical option and then the non-surgical option? So again, it's very tailored to specifically for the patient and their needs.
Okay, excellent. So, Dr. Rendon, I know there's a lot of interesting hobbies that you have. Would you mind sharing some of the things that you enjoy doing when you're not practicing medicine?
So when I'm not practicing, number one, I like spending time with the family. I'm a family man. I think it's important. When I do take some time for myself, one of the big things is I like to just try different things. I like being outdoors. I'm also a rated helicopter pilot. So I fly what they call R-22s. I'm trying to do a transition to even bigger helicopters. In the past, I've been part of the Air Force, and I'm actually going to most likely go back to the Air Guard as well to just, I enjoy that for the country. But a lot of the time I spend salsa dancing, playing soccer, but a lot of time it's with the family.
Okay, that's awesome. So just to let everyone know, what I'm going to be doing now is just give you a little bit of information about how you can find more information about our Bingham Healthcare's Empower Weight Loss Program, let you know what offices Dr. Rendon sees patients, and then how you can, and then we're going to transition into the question and answer portion of our Facebook Live. And like I said, please continue to be submitting your questions in the comments below. And if we have time to get to those, we'll be sure to answer those. And we're going to be answering some of the questions that have already come in before this webinar actually started. So just to let you know that Dr. Rendon actually sees patients throughout Eastern Idaho. He sees patients in Idaho Falls, Blackfoot, and Pocatello. The phone number, which actually will be coming up on the screen, if you want to reach out to the office, one of those offices to ask questions or, get some more information, you can call 208-782-3993. Again, you can call 208-782-3993, and the front office staff will be more than happy to answer any questions that you have. Also, we have a customized website. You can go to www.idahoempower.com. www.idahoempower.com, and there's a lot of information on there. And one of the main ways that people enter into the program is there's actually a free online seminar. And if you register and you take that, you watch that online seminar, then and get information, then that registers that you've watched it. You don't have to watch it all in one sitting. You can actually pause it and go about doing other things and go back. It actually will record how your progress. And then once you've finished it, an email actually gets sent to Bingham Healthcare's Empower Weight Loss Program, and then their team will then get back in contact with you and schedule an appointment or address any other questions that you've had. So watching the free online seminar is a really great on idahoempower.com is a really great place to start. Okay, so Dr. Rendon, we're going to go ahead and move into the question and answer portion of our webinar. Okay. And I just want to make this disclaimer that even though Dr. Rendon is answering medical questions just to the best of his ability, I just wanted to let you know that it's not considered it will not be considered a diagnosis. He's just trying to provide general information in response to the questions that have been asked. And then to make it technical is then you would actually have to have an in-person visit with either Dr. Rendon or another weight loss specialist, and to be able to have them assess you and, and be able to understand everything that's going on, to be able to make sure to make a true diagnosis. So I just wanted to make sure everyone understands that. Okay, so Dr. Rendon, under the category of general weight loss questions, we have a viewer who's asked, what's the cash price, and this may vary, but what's the cash price for a sleeve, or maybe in general?
So I don't get too involved with the actual numbers. There's people can help you in the clinic identify that, but you have to look at it in terms of kind of what is it worth to you. Bingham's done a good job of making it accessible to people, because we know that the trouble is that, number one, this can be expensive, but more importantly, what people are doing to obtain a weight loss surgery. A lot of people are crossing the border and spending money because they think it's cheaper, but you have to be careful because you get what you pay for. Having been a professor of surgery in Southern California, we had a lot of people coming from other countries, let's say, who had these weight loss surgeries because they thought they were getting just a quick cash price to get in and out. The problem with that is that, like I said earlier, this is a full comprehensive program. When you go down there, you're just there, do the surgery, then you're left to your own to figure out what you're going to do with that. I've taken care of a lot of people who have crossed the border with many complications who I just have not done well. A lot of revision surgeries that I've had to do to fix problems. I'm not saying they're all bad. I've operated in other countries. I've operated in Mexico, Ecuador, Moldova, Afghanistan, and there are good surgeons out there, but you just don't know who you're going to get. But again, there's no education up front, which is really important to understand what you're getting for this type of surgeries, because weight loss surgery, it's a tool, and you have to have the education up front and then the long-term follow-up that I discussed earlier. So it's real important, how to invest in yourself. You may want to stay stateside. And again, Bingham's done a good job of making it comparable so that you can have a full program with people who care about you and want to build that relationship with you. So that's the importance of having, if you're considering paying cash, because some insurances don't cover it. And that's a fact. But you get a full service, a program with that, with people who are going to follow you, make sure you have good outcomes in the long run. And then there's different types of surgeries which you have to consider. Your health can you do as an outpatient potentially, which may be a little cheaper, but if you qualify. So again, if you come in, we can evaluate you, see your health status, see things you may or may not need, and then we'll get you through the program. And again, we want you to have a good outcome and establish that relationship with you.
Okay, thank you, Dr. Rendon. And again, as Dr. Rendon mentioned, the prices are going to vary depending on the insurance, and we have a full team. Just to let you know that you won't only be working with Dr. Rendon if you decide to see him. We have an extensive weight loss team that are very passionate about what they do, and part of their job is dedicated to working specifically with insurance companies to be able to help you and provide you with as much information as possible. So, it's an excellent program and an excellent team. Okay, so the next question that we have from a viewer is, how do you get back on track after weight loss regain post weight loss surgery?
And that's a good question. It can happen, and it happens, like I said, most of the time because there's no follow-up. There's a lot of people who do kind of fly-by-night surgery, even here in the States, where they just operate on you and there's no true follow-up. So people do get lost in the system. And we actually provide that. There's also something called Centers of Excellence, which we're part of as far as the Blue Distinction Center, which we look at the quality and the care for the patient, which is important for what happens after the surgery. So if you are off track for whatever reason, well, we can, come on in and we can talk about it. Again, it's all tailored because we have to know what surgery you had, when you had it, maybe where it was done, and really investigate certain things of the surgery itself to get you back on track. It may be that it's something that's anatomic. It could be something that's an emotional issue. It may be just some teaching that maybe you never had. So, and that's where it's important to come on in. We can investigate to get you back on track, because there's many people out there who have had surgery, let's say 15, 20 years ago, and there's never been any follow-up, but they've had complications and problems, and maybe a simple revision or a simple education can get you back on track and actually get you back healthy to get you back where you want to go and find those goals again. And you have a support team. You have like Michael talked about, we have a whole team. It's not just me. We have the dietitians, we have people who care about you. We have some other mid-levels who go get you back on track with maybe just some medications you possibly need. So there's a lot that goes into it, but we have to investigate it and see, is it anatomic? Is it physiologic? What exactly would you be needing to get you back on track?
Okay, thank you. The next question that we have has a number of different parts to it. So I'll just take it one question at a time. For women over 60 who are regularly active, calorie expenditure 2,000 daily, and whose caloric intake is around 1,300 daily, how does one reduce pounds?
So that's a good question. The issue is this: it's not just anyone over 60. The body starts changing. When you're in your 20s, everything's wonderful. But right at 30s and 40s and 50s and 60s, things do change. And it's not just one specific thing. There's a kind of multifactorial in this sense. One thing they ask, is it a hormonal issue, which it definitely can be. Is it a stress or lifestyle issue? As you get older, you become more responsible and you have a lot more lifestyle things and other things that kind of come before you and taking care of yourself. So that's as well. And that causes stress. Stress, we know, releases a hormone called leptin, which can be a problem, and that can impede weight loss. Another thing, as we get older, muscle starts going away, and muscle burns fat a lot better. So we have less muscle, more fat. That becomes very difficult as well to start losing weight. The hormones is a big deal, especially in women, because estrogen levels change, and men aren't immune to this. Men have problems with testosterone. So then that becomes a problem as you get older. But again, those are things we have to look at to try to potentially have, if you like, a surgical option or a non-surgical option. We actually have many patients that come in, 60s, 70s, they come in for a weight loss surgery, and they do fantastic, actually.
Okay, excellent. Now, I know I thought it would be remiss if I didn't at least mention the last part of their question, and I know this would be very difficult without a diagnosis to answer, but I just at least wanted to ask it. So if so, in this woman's case, what labs would be done to be able to assess the situation?
So some of the just kind of basic workup labs to see what is going on. But again, it has to do not just one particular lab. It could be a thyroid issue. It could be some hormone issues. So it's more than one lab that you'd have to look at. But again, it's probably tailored to that specific patient, because every patient is different. I mean, I've operated on couples. I've operated on, people who are very tight, close friends. They've done everything their whole life together, but everybody's different. So we'd have to really assess that patient to see what labs may need to be drawn, or what their medical factors are that we need to help lose that weight.
Okay, great. Okay, the next question that we have from a viewer is, are there weight loss medications that are effective with no harsh side effects?
So it depends what you mean by harsh side effects, because every medication may have some effect. Everybody responds differently. Every medication does different things as well. Some impede certain things, some increase hormone levels, decrease hormone levels, block fat. So every medication is different, how it works and its efficacy, and how it affects people. Once again, everybody's different on how what happens to them when they take medication. I don't think anything is perfect, and that I'm not just talking about weight loss medication. I'm talking about any of your medication. So again, that's a tricky question to answer. But most of them don't have that many side effects. A lot of it is they just happen to be posted because the FDA or other bodies require them to. But again, it's individualized, and we'd have to see what we can do about that. If you're interested in medication, the non-surgical option.
Okay, thank you. And so far, thank you to all of our viewers that have been submitting these questions. We really appreciate your engagement, and we hope that the Dr. Rendon's responses are helpful and useful to you. Okay, Dr. Rendon, the next question that we have is there, or several people, are there different counselors that you recommend that work with your patients after surgery? So
the biggest counselor we can have is our team. And that's what you're looking for. And not just with our team, but if you're looking for any team, you want to see who's part of that team to follow you. Again, we have the dietitians, we have the mid-levels, you have me, you have the whole entire coordinating team. As far as for support groups, we have a great support group. We can meet on live and online as well, because some people can't make it into the program. The big key is to have a good, successful weight loss program, and after surgery for yourself is to have that good support system, which we do here at Bingham have, and the Empower program has, to follow you along. Because we want to build those relationships with you. We care for you. It's not just about, have the surgery and go home. That's not what we're about at all. We're looking for, again, weight loss is great. We're looking at those health issues get to improve. And it's not just health, but also psychological issues to improve. So we're there for you the whole step of the way. So any specific support group, we have that here, and we're here for you.
Okay, excellent. And just to add on for our viewer, we do have a team of mental health counselors. So if you were to go to binghammemorial.org and then on the homepage select physician specialties, if you were to be taken to the specialty page, you would be able to click on mental health counselors, and you would be able to see all the different counselors, what they specialize in. And then if you were in the Bingham Healthcare's Empower Weight Loss program, we have an excellent referral system. So to go one step further than Dr. Rendon would have a number of different counselors, mental health counselors, to be able to refer you to as well. So the next question that we have is, I've been working out and I'll lose a pound or two and that's it. What else can I do to lose the weight?
So that's a good question. And it's more than what people say. Most of the time you hear, if you just work out and eat right, you're going to lose weight. There's way more to weight loss than just, working out and exercising. So that's a common problem that people have. So again, it has to be individualized. We have to see, maybe draw some labs, see what your health issues may be. What can we do to either improve those or refer you correctly to someone who can improve those? Some people have, endocrine problems that need to be addressed. And again, we have this great non-surgical option if you want as well, where we can add a little medication and some education to get you to lose more weight and add on to what you're already doing as far as, exercising and dieting. So it's a lot about education and seeing what your health issues are. And we do offer that. And at some point, maybe if you do want surgery, then we can offer that as well. Again, tailored to your specific needs and what you think you may want in the future.
Okay, and this next question kind of ties into that a little bit, but I wanted to make sure to ask it. Is the person wrote in that they say that they have trouble losing weight in their legs. What is your suggestion? And they wanted to let you know that they're allergic to gluten. So
so the weight in the legs is a little trickier because we're all just built differently. We have a genetic makeup that where fat is distributed is kind of not up to us, unfortunately. But it's something we could help you with potentially as you drop some weight from either, again, non-surgical or surgical options. But that's a little trickier because that's more of a genetic thing. But once let's say you do, and it also depends how much you weigh. I mean, how much are we planning to get off with realistic expectations after potential surgery or even non-surgical? But then it's more of a genetic thing. So that may be just a little trickier. What I have noticed though is people, no matter what their body distribute or the fat distribution in their body, is that once they lose weight, it does become amenable to potential surgery afterwards, be it body contouring, which then people are very happy about. A lot of people, especially women, have what they call the wings under their arms as they lose weight, or the in the thigh, the mid thigh, which is very problematic as well. So post surgical, after you've kind of plateaued on your weight, there's options for that as well.
Okay, excellent. And then the last question under our general weight loss question category is, and this is probably, again, a little bit difficult to answer, but what makes someone a good candidate for weight loss surgery?
So and that's a great question. And my answer to that is if you're ready for it. Are you tired of being tired? A lot of people who really are good candidates is because they're done. They actually want to change their life. And they look at little things. Again, it may not be the weight, because a lot of people aren't too concerned about the weight. What they're concerned about is their health. And most of them want to be able to bend over to tie their shoes without having to suck up their gut because they can't move. They want to spend time with their kids. I understand out here, we're big outdoor, people in Idaho do a lot of outdoor things. They may not be able to go out with their kids and walk or hike as long as they used to, or do certain things. So I think to be a good candidate, I think you've had enough and you're tired and you just want to be able to live a little normal, not what so-called normal life, in the sense that you can do the things you want to do. I've heard people, and I ask patients, what is your goal? And one of the ones that always stuck to me was a lady once told me, I'm tired of not being the person I want to be. I'm tired of being stuck hiding under these clothes and not being, basically living my life. So I think that's what makes you a good candidate for wanting to have the surgery. Now, of course, there's the other issues, what is your health status? Which again, we will look into that. Well, that's a tailored issue. Different people want to get off medications, for instance. So, or they have heart troubles or sleep apnea, high blood pressure. So those are the things we look at and try to see, can we get you safely through the surgery for sure? But I say, what is a good candidate? Someone who wants to make a change and is ready for a change because they're tired of living in this shell that is not them anymore.
Okay, thank you. So now we're going to move into another category of questions that have been compiled coming in from our viewers, and this is under the topic of revision. The first question that we have from a viewer is, I had the lap band 7 years ago. Is it possible to reverse it and have the sleeve procedure?
So revisions are a great topic, and I'm very proud of the fact of where I trained and how I trained in my career. Most of my career has been academic medicine, which I took care of a lot of revision work because there's a lot of guys out there who would just do the surgery, who don't have a comprehensive program, who were, let's say they're a little bit older and they were just general surgeons or trauma surgeons or whatever, who just wanted to jump on the bandwagon. They were not fellowship trained. They really have no idea what it's like to deal with a complicated bariatric patient. So that's where I take a little pride in what I do and what I offer and bring to Bingham and to Southeast Idaho, is the ability to do revision surgeries. We've looked at a lot of, failures of lap bands or complications. There's been people that have been out there for, 15, 20 years with issues and nobody knows what to do about them. And that's where a fellowship trained surgeon can help. So I'm really proud of bringing that to you. So as a lap band, for instance, yes, it can be converted to a sleeve or gastric bypass or something else. But those do bring a little trickiness because everybody presents differently. Some do it because of weight loss. Some do it because of heartburn or pain or erosion of the band. So being able to offer a conversion to whatever you may need is something that we can very, very much help you with here at Bingham.
Okay. And the next question is, what is the criteria to qualify for a revision surgery?
Great question. Again, the criteria number one is you've had some other surgery. But the reality is that the thing is we really need to investigate is what surgery did you have done? What are your symptoms? Big thing is reflux. Another big one is chronic diarrhea or malnutrition. And that's important because I need to know what was done and what can be done. And that depends on the anatomy. So again, there's a lot of guys, and I'll be very honest, back a few years ago, and even some guys now, they're just hacks and they just do things because they think they can do it without truly being trained. So I need to investigate the anatomy. I need to investigate your symptoms. I need to investigate your health. And then we could potentially come up with a good plan to revise you to something that's going to meet your needs.
Okay, and moving on, after having a duodenal switch or DS, can you check your sleeve part of the surgery to see if it can be reduced? Absolutely.
Once again, going back to revisions, it's a matter of investigating the pouch or the sleeve itself that was done, and it could be definitely re-sleeved potentially. Again, I'd have to look at it, do the investigations, and see what we can offer you safely.
Okay. And then another viewer has asked you or wanted you to know, she said, I had a sleeve in 2015 and have successfully kept off 100 pounds. Just congratulations to that viewer on that huge accomplishment. But ever since, I've had severe acid reflux. It wakes me up at night and I almost have no relief. What would you recommend in this situation, Dr. Rendon?
So that's a common problem that I see as far as, again, revision work. It has to do with potentially the pouch or potentially having a hiatal hernia. The sleeve is a high-pressure system, which, again, I can explain that to you when you come on in. We can talk about it. But, yeah, it's very common. There's couple different options for that. Again, once investigating the pouch, seeing exactly what your symptoms are, seeing what your esophagus is doing as well, because it's maybe something else going on. So we'd have to definitely look at it, but something that can easily be fixed. And that goes back to, like I said in the beginning, some people are sitting around with these problems for 15, 20 years. And unfortunately, there's some physicians who don't deal with this, and that's fine, but who you should refer, and we can help you get treatment for that.
Okay, thank you. We have a viewer who's asked, can you have another gastric sleeve if you've already had one?
Well, the stomach isn't going to regrow itself, okay? It will stretch a little bit. So yes, the short answer is yes, you can re-sleeve a prior sleeve. A lot of times, because of the physics of the pouch itself, it will stretch, and we can potentially help with that re-sleeving, or convert to something else that maybe you've regained your weight and you want something a little bit different. We could potentially turn it into a gastric bypass or something that's going to, again, meet your needs in a safe manner.
Okay, and moving on to a general topic of surgery, sure. We have a viewer who's asked the question, what will eating be like after weight loss surgery?
So eating will definitely change, and that's a benefit because we want it to change. But it also depends what surgery you have. The one thing I could say kind of in general is that you will be eating smaller portions. You will be focused on eating, proteins first, nothing with high refined sugar because that could be bad for you. It is bad for you. And especially if you have a gastric bypass, because then you could develop something called dumping syndrome, which you're not going to feel so hot, but it'll definitely teach you how to eat. So you're going to kind of relearn to eat. But you know what? Be perfectly honest, most people aren't even that hungry anymore. You get the one-offs who could continue to be hungry, but again, you can't eat as much, which in which case you're going to lose your weight. And again, along with the weight loss comes the health benefits as well, because you will get healthier as weight comes off. Diabetes is cured, sleep apnea is cured, hypertension, many comorbidities that most people have out there can be cured with this. So the diet will change. Also, the hunger hormone leptin, especially with the sleeve, as it's taken out of the equation because that comes out as part of the stomach reduction, then you may not even be hungry anymore. So it's all a plus. It's all benefits, but it will change a little bit. The diet does start off slow after surgery. It started with some liquids, and then it's progressed to regular food. It's interesting. So I've operated, again, in other countries, and I remember going to Brazil and operating there, and their diet was coconut milk, which was kind of funny to me and strange, but it worked. When I was in Afghanistan, they had goat's milk. So it's a little bit different for everybody. That's not what we require. What we would like for you to eat at some point, get regular foods, small amount. But then that's all the education done up front, where we teach you what to eat, what to look out for, how to read labels to have you have a good, successful outcome in the future. Okay,
thank you. And we have a viewer who's asked the question, and I know this, I guess this would imagine, depending on the role that you're in, is how many weight loss surgeries do you do on average each year?
Well, like you mentioned at the beginning, I just came up here from Southern California, but I have, over 20 years of general surgery experience, over 18 years of bariatric surgery experience, and not just dealing with primary procedures. I've been a professor of surgery at two different universities, at East Carolina University and at Loma Linda University. I was the chief of the Veterans Administration System for what we call Vision 22 in all of Southern California. So I have years and years of bariatric surgery experience, as well as, all kinds of surgeries, but more importantly, not just primaries, but revisional surgeries. Again, those are the things you want to look into. What does your surgeon do? What can he do? Is he fellowship trained? So again, even if you don't come to us, I advise you to look into that, because it's really important you're getting the proper surgery you need, and not just about a quick buck kind of guy.
Okay, great. The next question that we have is from a viewer who's 32 years old, and they would like weight loss surgery. However, they're a keloid scar, which I imagine for people who don't know what that is, and maybe Dr. Rendon can elaborate on it. I think if you have surgery and you have a scar, actually afterwards, then there's the condition keloid scar, where the scar actually grows. So they're nervous about weight loss surgery because of that. What are the scars like for each type of surgery?
So, and that's unfortunate if someone is a keloid former. It's just the scar is getting thicker. I can tell you that less than 10% of the population actually develop keloids, but you never know who's going to get it. And it's actually different parts of the body kind of develop it differently. A lot of times in areas where there's a lot of stress, joints or whatnot, where there's a lot of movement, you could develop those scars. In the abdomen, you can do it, but I really haven't seen much. Again, less than 10% develop. So incisions are small. I do almost 100% of the surgeries laparoscopically. Not all of them. Some people should be done open for specific reasons, but usually it's a few incisions, less than about a centimeter each, and to do our surgeries.
Okay, thank you. Another question that has come in is, and I know that you've touched on this a little bit earlier, where it's all going to come down to the person and it's all going to be customized and tailored. But they're asking, in general, I need to lose 100 pounds. Is surgery my best option?
So going back to 1991, there was a National Institutes of Health Consensus Conference where it was pretty much stated that medically supervised weight loss was not as good as a surgical weight loss over the long run. So a surgery option, it depends. It depends on what you're looking for as an outcome. Do you want surgery or not? We do know that surgery does have a way better effect than just medically supervised weight loss over the long run. But again, we have to look at your health issues. And like Michael said, it is a customizable thing. If you have a really, really bad heart, for instance, then maybe it's not a good idea to have surgery. And then we look at our non-surgical arm, which we have very good success with. So it's one of those things you have to come in, we evaluate your health, and then see what surgical option is the best for you. That being said, 100 pounds is very achievable with one of these surgeries.
Okay, thank you. And we have another question that's similar. I'm at least going to ask it to acknowledge the person who took the time to submit the question, and then if there's anything else that you want to add on to it. The question is, what are the prerequisites to qualifying for surgical weight loss, the different procedures, and will insurance, Medicare cover it?
So let me start with the latter part of that. Medicare definitely does cover it. They do require certain things, which our insurance specialists will be more than happy to go over, not just Medicare, but any insurance you have. Once you come on in or fill out the form online, we can get that information for you because we have the great insurance specialists and great care coordinators who will take care of you and look into that for you. So yeah, every insurance is a little bit different. They have certain requirements, but those are we can get that information for you. And now I forgot the first part of the question, not you mentioned.
They were asking, what are the prerequisites to qualifying for surgical weight loss?
So most insurance require a BMI of 35 or a body mass index of 35 plus a medical problem like sleep apnea or high blood pressure or diabetes. Or if you don't have those, then you need a BMI of 40 without. Those are the basic requirements by most insurances to be a candidate for bariatric surgery, along with the fact that, again, it comes into my part in this is, well, what is your medical history, which I need to make sure we're going to do this safely for you.
Okay. And we have additional questions that have been coming in. And so they're going to be a little bit, they're going to be a little bit more random instead of being in a category, just to give you a heads up about that, Dr. Rendon. Okay. So the question that has come in is, I had the VSG, which you'll be able to elaborate on. I had the VSG done on December 16th, imagine of 2020, and it seems like I'm hungrier than before. It's not a head mental hungry either. I wake up and my tummy is growling. I eat, then I'm hungry 2 hours later. It's been consistent since surgery. I feel like I eat more often, although it's way less. Is this normal for almost 4 months post-op? And also, they seem to have hit their weight loss plateau. They've been the same weight for a month. How would you respond to that question, Dr. Rendon? So
a VSG is a vertical sleeve gastrectomy, or otherwise known as a sleeve gastrectomy. That's for just what that stands for. 4 months is still very, very early on from any bariatric surgery, no matter what you have. Most of the time, you're going to really plateau at about a year to year and a half. And everybody's individual. Everybody loses weight at different rates, and they lose different amounts. Kind of like I said earlier, I can operate on husband and wife, and we just have totally different weight losses at totally different times. The big thing I do focus on, and when I tell patients and I counsel them initially before surgery, is that you're going to plateau many times during that first year and a half, and you're going to kind of be frustrated. Which apparent this viewer sounds a little frustrated. They kind of think they may have plateaued already, but you may not lose a pound for a few weeks, or like they're saying, maybe a month. Give it time. Follow the program. Follow up here with the nutritionist and with the team, and we can guide you through that. I tell people, don't focus on the numbers. Okay. I know it's a habit. People want to jump on that scale and see how much they weighed 2 hours ago, see if they lost 20 pounds. It's not going to happen. So I said, don't focus on the numbers. If you're determined to step on a scale, give yourself 2 weeks at a time, 2-week break in between sessions, or 1 week. And you'll see it will continue to come down. Focus on other things. Number one, your health. Maybe you're off your medication. You visited your doctor and he's already taken you off of high blood pressure medication, for instance. Or maybe your clothes is fitting better. Or maybe you're able to bend down a little bit, or maybe increase your length of walk without being short of breath. Those are the important things that we could focus on. As far as being the hunger, everybody's a little bit different. You do eat less amounts, so that actually helps increase your metabolism, which is fantastic. As long as you're not able to go and have a huge meal, then we're going in the right direction. But 4 months is still very, very early on to be super frustrated about it. I understand it. But I've seen it for a long time, and it's just a matter of, let's keep waiting. A year and a half, when you're really going to plateau in your weight.
Okay, thank you, Dr. Rendon, and thank you to our viewer who wrote in with that question, and to everyone who's been engaged with our Facebook Live webinar. Just to let you know, to let all of our viewers know, we're getting close to the end of the time of this particular webinar. I have a few more questions that I'll have time to ask, but then again, if you feel free to continue asking questions, even when this is recorded, even if you're not watching this live, if you're watching it somewhere else, please still feel free to submit your questions. We have a social media team that is always reviewing all of our Facebook posts, and any questions that come in, we are always be sure to respond to those as quickly as possible. So even like I said, even if I don't get to your question today for Dr. Rendon, you should feel free to keep submitting those, and we'll get with Dr. Rendon, get those questions to Dr. Rendon, and submit responses so that everyone who's participated can feel included in this particular webinar. Okay, so Dr. Rendon, I have a couple more questions before we reach the end. Another one that's come in is, I've had a gastric bypass and they were doing good until their RA, we're assuming that you are talking about rheumatoid arthritis, took over. They say that they can barely get around. They have a hiatic hernia and stomach problems. They say no one will fix their hernia because of the gastric bypass. The person states that they started out at 250 pounds and was down to 150, but since their rheumatoid arthritis has kicked in, they're now fluctuating. Their weight is now fluctuating between 175 and 190 pounds. Their question is, what can I do, and will my insurance cover it? They stated that they're on Blue Cross Blue Shield of Idaho.
So as far as the insurance, I'll refer that to our insurance specialist. Revisions, it's a revision surgery question, essentially. If you have a hiatal hernia, that's it's, in my experience at least, it shouldn't be a problem. Okay, you have a hiatal hernia and you have a gastric bypass. A gastric bypass is what we call a low pressure system. But if you have a hiatal hernia, you can still have that reflux going into your esophagus causing these problems. Again, if you come on in, we can take a look at it, investigate the pouch, and there's definitely a possibility of fixing this for you. Fixing the hiatal hernia is not that big of a deal. I mean, it is surgery, will be involved, but it's doable, and try to get you a better outcome. Try to control the issues you're having now. And it could be you may have a stricture in your pouch actually that's causing the problem. Excuse me, in the anastomosis, you have a stricture in anastomosis. I just took care of a lady who had that specific issue. She had a gastric bypass. She's been seeing her gastroenterologist for years, dilating this over and over and over, and they never actually dealt with a real problem. I revised her, and she's doing fantastic. So I would encourage you to come in, let's investigate the pouch, let's talk, let's see what your real symptoms are, and see what can do for you. Some people just don't like doing revision surgeries. One, because it is a little bit more complicated. Two, because they have no experience and they don't want to muddy their hands in there, which is probably better for you, to be honest with you. Again, you probably want a fellowship trained surgeon who knows what they're doing. But yeah, come on in. I don't see that as a big issue.
Okay, great. Thank you, Dr. Rendon. Another question that we have is, I have a married son who has a family, and they are studying to be a pharmacist. He has bad insurance and is extremely obese. What can you recommend for him without surgery, even though he needs it, but cannot afford to miss school or work?
Number one, congratulations. He's studying to be a pharmacist, and he's working hard and going to school, which is very important. The issue is the insurance could be a problem, but again, there could be options we could potentially offer here. But if he's looking for non-surgical, we have a great non-surgical option as a tool in Empower's program here. Another thing is if it's time that he can't come in, we also have telemedicine visits or telehealth visits where we can help accommodate him so he can not miss school or work and yet have the treatment he needs and potentially get him on a non-surgical route for weight loss. So again, it's a matter of coming in and let us see how we can help you out and tailor something specifically for him.
Okay, great. Thank you, Dr. Rendon. And I'm glad that you brought up telehealth visits, just to let our viewers know that we are still offering telehealth visits for a number of our different specialties where our doctors do not require you to come into the office. You can actually set up an appointment online and be able to do a webcam with our doctors and Dr. Rendon in particular. Or you can do appointments, have conversations over the phone. So always be sure to ask if we can accommodate you for that. The other thing that we have, and sometimes people are unable to drive themselves or don't have a car or transportation, we do offer a transportation service through all of our different clinics. So if you're calling to schedule an appointment and you need a ride or to be picked up or dropped off at your home, just be sure to ask our front office staff about that service, and they'll give you all the information to be able to accommodate you as well. Because we want your health to be your number one priority, and we want to make sure that there are no obstacles or there are limited obstacles, so you're not deterred from coming into the office and dealing with with any medical conditions. So always be sure to call call our front office and ask those questions. We have solutions to a lot of different, we have answers to a lot of different questions. Okay, Dr. Rendon, as I mentioned, we're nearing the end. I just have one more question. It's more of a general question. I imagine that it can be, if people are dealing with obesity and really want to change their lives, but they kind of feel stuck, which you alluded to earlier. I would imagine it would be really scary for a lot of people to actually want to put themselves out there and to be able to schedule an appointment with you and say, okay, I know I need to make this change, but how do I go about doing it? What kind of maybe reassuring words would you offer to prospective patients that would be afraid to come in or afraid to change their life, to let them know some of the positive benefits of actually taking that first step?
So number one, I tell them that they're not alone. There's so many people out there struggling with this. They're struggling with the weight, with the health issues. They're discriminated against just because of their weight. Forget about the skin tone, just because of the weight. They've always had that issue. So we understand that, and we're here to encourage you to build these relationships as an entire team, to bring you in, and not just you, but other family members as well that may want to come in with you or may not understand what you're struggling with, or maybe the thought that you want to have something done. So we're here for you. We're more than happy to help and talk you through all of this and encourage you and invite you to be part of our team to help support others. We have the support groups people who have been there already. And it takes a lot of courage actually to admit and say, you know what, I need some help, and it's okay to come on in. And if you have nobody, you have us. We're the family for you guys to take you to that weight loss goal or your journey through it. I think what encouraging words say is that I'm here for you. I know I'm here for you. My whole team is here for you. And I'd be more than happy, because I've been doing this for a long time. I've had patients come into the office, crying because they had nobody. They needed help. They've reached the end of their goal. They really want something done. And so I'm here. I'd be more than happy to talk to you, give you options, and be completely open and honest with you, and be your cheerleader. Our whole team is your cheerleader. If you have nobody, well, you got us. So I'd say, please come on in. If you have any inclination that you need help or want help, then we'll be here for you.
Awesome. Thank you so much, Dr. Rendon. And just to let you know, to remind you, Dr. Rendon has done a really great job about talking about the Empower Weight Loss Program at Bingham Healthcare. But if you'd like more information, one of the first steps that you can take is if you go to www.idahoempower.com. If you go to that website, you can actually, there's an online video, and it talks all about the program and the specifics of it. So if you'd like some more information, that might be a good place for you to start. And if you watch that video all the way through, then you'll actually be contacted by our weight loss team, and they'll kind of point you in the direction of next steps. The other thing is, again, Dr. Rendon sees patients in Idaho Falls, Blackfoot, and Pocatello. So he's conveniently located throughout eastern Idaho. So you could visit whatever one of those offices that's most convenient for you. And if you do need a phone number, if you do have questions and you want to talk to one of the weight loss staff and kind of get pointed in the right direction, you can call 208-782-3993. Again, you can call 208-782-3993. Okay. Again, I'd like to thank all of our viewers watching this Facebook Live webinar. It was a real pleasure to be able to host this and be with Dr. Rendon today to answer all of your questions. Before we wrap up, Dr. Rendon, I know we've had a lot of questions. I just wanted to throw it back to you. Is there anything else that you wanted to mention to our viewers, or anything that maybe people didn't ask?
Just going back to the question you had about, what can we do for people? You're not alone. There's a lot of people who are out there who need help and want help, and maybe just afraid to ask. So just ask. I mean, we're here. That's really what I say, that we're here. I know how hard it is to the struggles you have with obesity, or just weight in general, or how you feel maybe even about yourself, or that uncomfortable feeling you have, maybe even looking for clothes, or like I said, even bending over to tie your shoes. Those are the things we worry about people, and we're here to help those people for that. Okay. Thank you very much for your time today, Dr. Rendon. It's been a real pleasure having you here. Thank you very much. Appreciate it. And again, thank you to all of our viewers. Thank you to everyone who's tuned in to Bingham Healthcare's Be Informed webinar. From everyone at Bingham Healthcare, we hope that you continue to stay safe, happy, and healthy in everything that you do. Thank you.